to indicate whether they're going to participate in the exchange. And not surprisingly, a number of plans have chosen not to enter the exchange marketplace in New Jersey. I think they can still sell plans off the exchange, and I haven't talked to them yet as to what the rationale is if we're not participating in some markets. But if my product's going to be taxed at 3.5% if I sell it on the exchange, and I'm able to sell it off exchange, you have to wonder why you're going to have a distribution mechanism through the exchange as a higher tax option. The exchange also, I do want to note, I think that most of the energy is going to be around the individual market. So there's created a small employer exchange and an individual exchange. The small employer market exchange, most small employers, like myself, I have a small association with 3 employees. We mostly care about price and net. The opportunity to buy online doesn't really make a game changer for us in how we make our decision. We'll probably hand it off to an insurance broker to help them shop around for coverage. But I don't see a whole lot in the way of activity in the small group exchange. The individual market exchange, however, with the availability of subsidies, is where a lot of the energy, I think, should be placed. And we've got to make sure that that's right, because that's the vehicle for coverage expansion and where we hold the most promise to attack the problem insured. So just a note on the affordability. A little further, deeper dive on factors affecting the cost. I did mention pediatric dental and vision. There's dollar caps that now have to be instituted on essential health benefits. When plans have higher dollar caps or sort of greater cost sharing for the covered person, the higher those caps, the lower the premium. To the extent that you lower those caps, you're going to be increasing the premium, and so that's going to have an impact. As I noted in some of my previous presentations, there's a key change in the pharmacy benefit too, in that the maximum out of pocket right now is separately driven for pharmacy benefits versus medical benefits. It's going to be an all-cause out of pocket. So the pharmacy exposure and the medical will both be fed into the same bucket, so you will hit your maximum quicker. So again, it creates a much richer benefit for folks. The states weren't required to do that in 2014, but New Jersey chose to do it because it would have had to change in another year. So those are the key changes I think they're going to have an impact on to help increase the cost of coverage. I did talk a little bit about this, and how does the state and federal government try to control the insurance premiums on what it does with insurers is through this minimum loss ratio requirement. So there's sort of a prospective element and a retrospective element. The prospective is the filing of rates. So when insurance companies file rates, they have to have an actuary attest that they are going to try to meet a certain target minimum loss ratio. So in New Jersey, it has to be 80%. They may shoot for 81 or 83%. So that's the sort of prospective review of the appropriateness of the rates. And then there's this retrospective review, 80% for the individual and small group market and 85% for the large group market. I would say on average in New Jersey as an aggregate runs in the high 80s in terms of its minimum loss ratio. So I think we'll probably run a little bit behind, but I did want to talk about a couple conclusions that I personally had. I think I've made this point that affordability will continue to be the largest barrier to access to coverage that we have. Joel pointed out previously, calling the Affordable Care Act. Obviously, there's some good things that will help drive down costs. It will provide subsidies for lower income folks, but it hasn't. It's not likely to change the initial cost of coverage, and it's going to be out of reach of many individuals and others. I do think that the individual market will be where most of the action is around the exchange, because that's where the subsidy is. If Massachusetts was sort of the canary in the cage for healthcare reform, that's certainly what we saw there, is that it had a very robust individual market exchange and a fairly inactive small employer exchange. A third point, I do think that New Jersey's out-of-network costs make us an outlier state. One of the challenges that we have is a regulatory requirement around the emergency room services, so that if you go to an emergency room at an out-of-network facility, New Jersey law requires that the consumer be treated as if they went in network, so their cost sharing is limited. On the back end, there's no agreement about the price, and with very high charge masters, like we've seen in some recent reporting, plans are paying out-of-the-year charges for a lot of these services. So it continues to be sort of a confounding problem for New Jersey. There was a recent hearing in the Senate Health Committee on this just the other day. And I guess the other point is to echo the point that Joel had made, which I don't have a bullet for, but it's that there's an enormous amount to do between now and October when this thing has to be up and running. There's still a lot of last-minute regulatory guidance that's not available to us yet. While folks are working very hard, this will be an enormously challenging period to get this up and running. So I wanted to thank you for your attention and answer questions.
So for the individual market, I think it's great that you're optimistic and that we're optimistic. What do you think that population will look like? Is it going to be the unemployed or the young adults? How does the Massachusetts population look?
Yeah, so I think in the individual market exchange, it's going to be subsidy driven. The recommendation health policy, which is I think an awful lot. They did a really they did a good study a year or two ago, looking at the anticipated influx of folks. They found the individual market too is where most of the action is going to be. In terms of what the population looks like, one of the interesting findings that they had was that the relative risk of the folks outside the marketplace looked to be a little bit actually higher than the folks in the existing marketplace. So that could be just a challenging in terms of the sort of affordability aspect. Plans will have an incentive. This is always a difficult thing, but the higher the rates go, the more you chase away the lower, the younger, healthier folks in the marketplace. So there is an instinct to try to control those rates as much as you can to try to sort of lure those younger, healthier folks in so that you can better finance the whole system. But I think that a lot of these will be young adults at lower income where the subsidy levels are much, much higher. Thank you.
Thanks, Lord. Okay. Rich Bagger is here. As kindly suggested, we take a break. The caterers are going to bring in lunch, so suggest just like in the classroom environment, take 10, and we'll reconvene.
I said lunch. By the way, we gave Mark that's a couple minutes ago. We served you about the book, and everybody's been getting it. What's great? Open source. Yeah. I brought a hard copy with me because of course we didn't get the yes for 3 o'clock. I didn't bring my copy because I need another one for me. But he was going, wow. I said, what's even more important is everything is done. Every statistic is validated. That's the That's right.
I can make the chart.
That's what it is. And by the way, thank you so much for speaking. And in fact, nobody knocks
These things can go on all day and be curious.
and phones. I got my kids on calendar. It must be about, I guess it's about this. Oh, yeah. But I don't know what the company.
I think you just wanted to.
Yeah. No, that's good. I just reaching out to the entire prospects by colors. I got a lot of voicemails and some more materials. Trying to get a good signal. Hopefully, we can get it. I can get it fixed for them. Because don't forget, this is just one tactic. I've had some very serendipitous situations. Like I was sitting at a meeting between 2 former members of the prosecuting committee. So I talked to all the chairman.
It's an alliance.
Well, the best part of it was Kevin saw how hard this is. You always want your boss to see you.
Well, it's just a close to that number of what you're anticipating. So I think we should look this out.
Yeah.
That's 20.
20 of them plus the rest of us.
That'll work for the.
Yeah.
Good. Good.